This program presents an overview of the outstanding experiences at Tehran University of Medical Sciences, produced with the aim of introducing successful experiences at the university. It is intended to strengthen the sense of solidarity and apply these experiences in similar situations, and it is published in the media. It's the first experience, performing brain surgery while the patient is awake.
Can you hear my voice or not? Can you count for me, dear? Count slowly, okay? Speak up because the doctor wants to hear your voice, all right?
This surgery is performed with the most experienced surgical team, anesthesia, imaging, and brain mapping, using advanced devices for neuromonitoring and cognitive monitoring. Dr. Ahmadpour Rashid talked about this procedure.
Integrate advanced imaging data into one MRI, visible here in colors next to the tumor. We need to convince them that in addition to the usual scans they provide us, we should also use advanced scans taken from the patient, like fMRI, which shows the brain during surgery, and data that illustrates the white matter tracts of the brain. We want to integrate all of this into one MRI, and you can see it here in different colors next to the tumor. This helps us during the surgery, while we are talking to the patient, to avoid areas that are very important for the patient, as touching them could cause severe damage. There are different areas that are very important for the patient, and if we touch them, it could cause severe damage to the patient, so we avoid going in that direction.
Another successful experience of Tehran University of Medical Sciences is the collaboration with the Cystic Fibrosis Foundation of Iran, which has led to an increase in the lifespan of cystic fibrosis patients, as it is one of the most common recessive genetic disorders in the world. Dr. Mohammad Reza Modarresi, the president and CEO of the Cystic Fibrosis Foundation of Iran, talks about the successful results of this teamwork.
A CF team needs to be visited and the team must respond. One person cannot treat CF and we won't get any results. Right now, we have 7 branches which is rooted in the Medical Center and the University of Medical Sciences in Tehran. Although it is currently a national entity, it actually started from the University of Medical Sciences in Tehran. This is one of the honors of this university.
The successful experience of specialists from Tehran University of Medical Sciences in reconstructive surgery related to tumors and conditions of the jaw and face using custom prosthetics. This achievement is the result of the joint collaboration between oral and maxillofacial surgeons and biomedical engineers, which has been taking place since 2019 for the first time in Iran and the Middle East. Dr. Abbas Karimi, head of the Department of Oral and Maxillofacial Surgery at the university and head of the Oral and Maxillofacial Surgery Department at Shariati Hospital, explained this success.
This section is the oldest part of facial and cranial surgery in the Middle East, and many patients come to us for treatment from all over the country and even from neighboring countries. In terms of treating patients, we are quite advanced on a global scale, whether it's regarding these custom prosthetics or other treatment methods.
With the production of skull and facial prosthetics at the knowledge-based company Danaville of Tehran University of Medical Sciences, 200 successful surgeries have been performed so far. Dr. Sayed Ruhollah Godsi, the chairman of the board of Danaville, explains the features of the produced prosthetics.
Danaville Company was the first company to obtain a license for the production of custom skull and facial prosthetics in the year 2016. 2 of the important features of these prosthetics are their production time and cost, which are significantly better compared to foreign samples. In the past, when these prosthetics were not produced domestically, it would take at least 2 to 3 months to create a prosthetic and bring it into the country. But now, this time has been reduced to between 7 to 14 days.
Tehran University of Medical Sciences, with the efforts of its specialists, has successful experience in saving the lives of newborns suffering from urogenital disorders using a laser photoscope. And so far, 200 surgeries have been performed in this field. Dr. Marsusi, an obstetrician and perinatology fellow at Tehran University of Medical Sciences, said about this success.
The placenta is shared and balanced. However, sometimes 10-15% of the time it becomes unbalanced, causing one cell hyperemia, another anemia. Laser therapy is best entering anastomoses, placental beds, using laser energy to ablate them, controlling the disease. We identify the causes of this condition. As a result, the disease is controlled.
Another successful experience of Tehran's medical university is dedicated to introducing a successful collaboration in over 1,000 endoscopic skull-based surgeries. Dr. Mahdi Zahanalizadeh, head of the surgery department, said the following about the successful outcomes of this joint experience.
Since 2000, when we started our joint operation, everything has been team-oriented. And we take pride in the fact that every part of the patient's surgery meets the latest global standards. What has made a difference for us here is that now we have performed over 10,000 surgeries